This is a diagnostic ultrasound demonstration of the subscapularis muscle. The subscapularis muscle is within the shoulder joint, running from the subscapular fossa of the scapula to the lesser tubercle of the humerus. As part of the rotator cuff, the subscapularis primarily performs glenohumeral internal rotation and aids in shoulder adduction and extension. To find the subscap with diagnostic ultrasound, the patient should be seated with the elbow bent to 90 degrees and the shoulder in external rotation. This will stretch the subscap tendon and make it easier to locate. The examiner should be to the side of the patient. When in short axis view, the indicator on the probe should point to the right side of the patient. In long axis view, the indicator should point towards the patient's head. When using ultrasound, apply gel over the entire area you will be working in. Start in short axis view at the superior aspect of the shoulder over the AC joint. Slowly scan downward, keeping the probe perpendicular to the patient's body. When identifying the subscap tendon, we are looking for hyperechoic or bright tissue with dense striations. In long axis view, start with the probe on the lateral aspect of the shoulder and scan medially. If the subscapularis tendon is identified but there is disruption in the linear striations, increased fluid collection, or decreased echogenicity of the tendon, there may be a pathology associated with the tendon. Transverse view, we can identify the humerus by the reflective line of the bone's surface. The deltoid muscle has irregular striations within hypoechoic tissue, which gives a starry night appearance. The subscapularis tendon is between these structures, as seen by the hyperechoic dense striations. Similarly, in long axis view, the humerus is identified by a reflective cortex. The deltoid still appears as hypoechoic with irregular striations, and the subscapularis is between these, appearing more hyperechoic and densely striated. When the clinician is experienced in using diagnostic ultrasound, it is a good method of ruling out and ruling in subscapularis tendon pathology. For those less experienced at using this tool, ultrasound is good at ruling subscap tendon abnormalities in, but bad at ruling them out. It is very important that the clinician is experienced in using diagnostic ultrasound to evaluate the subscapularis.